My dear children, today's topic is dissociative disorders. Now, what is the meaning of dissociation? Dissociation means separation of normally mental processes. And several memorable books and movies have portrayed dissociative disorders. And the concept of dissociation, if you know, is over a century old. And dissociation refers to the human mind's capacity to mediate complex mental activity in channels split off from independent of conscious awareness. That is important. And we all dissociate to a degree some of the time. Mild dissociative symptoms occur when we daydream or lose track of what is going on around us. But when we call disorder, and like somatoform disorder, and already I discussed, and dissociative disorders appear mainly to be always of avoiding anxiety and stress and of managing life problems. So one of the cause of dissociative disorder is stress. And what is dissociative disorders? Sudden temporary alternation of consciousness that blot out painful experiences are a defining characteristics of dissociative disorder. And the types of dissociative disorder according to DSM-5. Dissociative amnesia, dissociative identity disorder, depersonalization or derealization. Now, what is dissociative amnesia and part of dissociative amnesia and dissociative fugue? Now, fast case study and listen carefully. A brute, a 42-year-old short-order cook in a small-town dinner, was brought to the attention of local police following a heated altercation with another man at the dinner. He gave his name as Brute, but actually not. He had arrived in town several weeks earlier. He could produce no official identification and could not tell the officers where he had previously lived and worked. Brute was asked to accompany the officers to the emergency room of a local hospital so that he might be examined. Brute's physical examination was negative, obviously, for evidence of recent head trauma or any other medical abnormalities. Meanwhile, the police discovered that Brute matched the description of one Saunders, a resident of a city some 200 miles away who had disappeared a month earlier. The wife of Mr. Saunders confirmed the real identity of Brute, who stated that he didn't recognize Mrs. Saunders. Prior to his disappearance, Saunders, a middle-level manager in a large manufacturing firm, had been experiencing considerable difficulties at work and at home. Just to identify the cause, stress. A number of stressful work problems, including failure to get an expected promotion, loss of some of his key staff, etc. So now, what is dissociative amnesia? Dissociative amnesia or psychogenic amnesia is usually limited to a failure to recall previously stored personal information. And when that failure can't be accounted for by simple forgetting. Yes, forgetting is different. That means, or cognitive forgetting is different. Dissociative amnesia is characterized by extensive but selective memory loss that has no known organic cause. Yes, and the gaps in memory most often occur in stressful circumstances. such as any kinds of combat situations, any kind of serious accident, etc. And some people can't remember others, can no longer recall specific events, people, places, or object, while their memory for others' events remains intact. And just to read the case study properly, okay? And you know, in typical dissociative amnesia, that means the reaction of dissociative amnesia, the individuals can't remember certain aspects of their personal life. Yes, any kinds of important facts about their identity. And only, you know, a particular type of memory is affected, such as episodic memory and autobiographical memory. Yes. And now, what is dissociative fugue? A part of dissociative amnesia we call dissociative fugue. Essential feature of this could be an unexpected travel away from home and workplace, and assumption of a new identity, and the inability to recall the previous identity. And the fugue usually ends when the person suddenly wakes up with no memory of the events that occurred during the fugue. And again, the cause, you know, stress. Yes. Now, another case study. And 35-year-old Mary, divorced social worker, had in her right forearm and hand chronic pain. Medical management of this pain had proved problematic, and it was decided to teach her self-hypnosis as a means whereby she might control it. And she proved an excellent hypnotic subject and quickly learned effective pain control techniques. And in the course of one of the continuing hypnotic session, the psychiatrist again asked about lost time. Yes, and was greeted with a response in a wholly different voice tone that said, "It is about time you know about me, Marian," an apparently well-established altered identity. That means, you know, the Mary and Marian. Yes. And the other identity, you know, Marian. Marian was an extraordinarily abrupt and hostile person. Yes. And now, so what is dissociative identity disorders? Yes, what is dissociative identity disorder? And you know, people with dissociative identity disorder may adopt various kinds of new identities. Yes, and all simultaneously coexisting. Yes. So, dissociative identity disorder, often referred to multiple personality, is the most dramatic of the dissociative disorders, and often associated with traumatic experiences in childhood, and the person assumes alternate personalities that may or may not be aware of each other. That is important, you know. So the important, you know, dissociative identity disorder, and the patient manifest two or more distinct identities that alternate in some way in taking control of behavior. And there is also an inability to recall important personal information that can't be explained by simple forgetting. Yes, and each identity, you know, may appear to have a different personal history, self-image, name, and the case study I have discussed. Yes, although there are some identities, they are only partially distinct and independent from other identities. And now, depersonalization and derealization. What is the meaning of depersonalization and derealization? And case study. 20-year-old male college students and psychiatric consultations because he was worried that he might be going insane. For the past 2 years, he had experienced increasingly frequent episodes of feeling outside himself. These episodes were accompanied by a sense of deadness in his body. And during these periods, he was uncertain of his balance and frequently stumbled into furniture. And this was more apt to occur in public, especially if he was somewhat anxious. And the patient's subjective sense of lack of control was especially troublesome. He could fight it by shaking his head and saying stop to himself. So, what is depersonalization and derealization? And depersonalization and derealizations involves a dreamlike state in which the person has a sense of being separated both from self and from reality. Yes, from reality we call derealization and from self depersonalization. In depersonalization, there is a change of self-perception and the person's sense of reality is temporarily lost or changed. Yes. And depersonalization experiences of, detachment and derealization and experiences of unreality or detachment with respect to surroundings. Yes. And these kinds of symptoms cause clinically significant distress or impairment in social, occupational and other day-to-day life. Yes. And only for your informations, the causes of dissociative disorders. And according to psychodynamic viewpoint, people fight off anxiety by unconsciously preventing painful memories, thoughts, and impulses from reaching awareness. Yes. And dissociative identity disorder is thought to result from a lifetime of excessive repression. Repression is one kind of defense mechanisms. And according to behavioral viewpoint and behaviorists believe that and dissociation is a response learned through operant conditioning. Thank you, my children.